Allow me to start first by saying that FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice and pharmacists at health system level, FIP DG 7, advancing integrated services. Let us start by some housekeeping for the webinar. The recording will be freely available on our website at www.fip.org. You may ask questions using the question box provided, and you are welcome to provide your feedback at webinars@fip.org. And if you want to become a member at FIP, please visit our website at membership registration. Barbel, welcome. Barbel?
The next one. Yeah, Marwan Akel and I will guide you through this webinar. Marwan is a pharmacist with a PhD in public health. He is currently a clinical associate professor at the Lebanese International University, where he is the chairperson of the pharmacy practice department. He is an active researcher working on different aspects of pharmacy profession and education. Last year, he was granted the FIP Fellowship. He contributes locally, regionally, and internationally to pharmacy activities and advocates for the role of pharmacists in healthcare. He is the lead of Development Goal 7, Advancing Integrated Services, and he is part of FIP's transformation program.
Thank you, Barbel. Barbel is my colleague in Working 7. She's working as a community pharmacist, as has been an industry pharmacist. She's lecturing and does research on innovation, access to innovation, and is guided by the principles of sustainability, diversity, and equity. To me, she's a good example of the one FIP colleague. She's an active in practice, science, and education. In her case, all three dimensions are interdisciplinarily connected, and also she's active in healthcare business and economics.
Thank you, Marwan.
So, transforming vaccination regionally and most welcome. Transforming vaccination regionally and globally is the first FIP transformation outcome-based online program, and it will be underpinned by the FIP Development Goals, FIP DGs. The final outcome of the program is a historic global FIP commitment to action in vaccination in pharmacy, and it's the FIP Transforming Vaccination Collection 2021. The series run from September to December. It's out 3 series. The first one was identifying transformation needs, and it ran from September to October. We are now in series 2, and today we are in episode 2 of series 2, which discusses the mechanism and drivers to progress the most relevant FIP development goals in the context of transforming vaccination in pharmacy. And the third series, which is in December, has a main outcome of delivering a global FIP commitment to action on vaccination in pharmacy across the 6 regions of the world. We urge you to engage with us and help us answer the following questions. What single factor should be prioritized to transform pharmacy vaccination services globally and regionally? 2, what would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? And 3, what else should the FIP commitment to action outline? Please use the chat box to answer these questions. In today's episode, Empowering Pharmacists to Deliver Vaccination at Health System Level, it's an interview format that focuses on FIP Development Goal 7, Advancing Integrated Services from the Perspective of Vaccination by Pharmacists. We will discuss the change management principles in the context of integrating advanced practice services into everyday practice and ensuring that vaccination by pharmacists in all settings and jurisdictions is consistent with best evidence and practice guidelines. Where we have a pharmacist, in any setting, vaccination can be provided, thus ensuring collaborative work and shared documentation with all healthcare professionals to ensure the service as an integrated one. Among many others, our main outcome for today is to understand the impact of FIP Development Goal 7, Advanced Integrated Services, in the transformation of vaccination globally and regionally.
Sophia Segura, Pamela Logan, and Scarlett Pong will share with us their view on how to empower pharmacists to deliver vaccination on a health system level and in all settings. The next, Marwan. I am pleased to introduce to you our first speaker, Professor Sophia Segura. Sophia Segura has a Master in Pharmacology and Drug Management from the University of Costa Rica. She is professor at the School of Medicine at the University of Costa Rica for more than 10 years, where she has directed several projects related to the responsible use of medicine in the elderly population and their caregivers. Sophia is coordinator of the institutional program for adults and older adults of the University of Costa Rica. In addition, she has worked as a collaborator of the FIP with the documents Pharmacists who support women in the responsible use of medicines, empowering informal caregivers, and Give It a Shot, expanding immunization coverage through Pharmacists. She was member of the board of directors of the College of Pharmacists of Costa Rica from 2016 to 2018. Since 2015, she is member of the Commission of Pharmaceutical Specialties, and since this year, member of the International Pharmacy Affairs Commission, College of Pharmacists of Costa Rica. Sophia, the floor is yours.
Hello to everyone, and thank you very much, Barbara, for such a kind presentation. And I want to say that I am very honored to share this conference with remarkable colleagues, Marwan, Barbara, Pamela, and Scarlett. It is interesting to study this FIP proposal. On the next slide, I would like to say that related to this vaccination services, I want to say that during the series 1, different topics were addressed, focused on identifying the needs of pharmacists and pharmacies. Now, at this moment, a new challenge arises. How can this work can become an achievable project? But what does this mean, and what is the ultimate goal? The ultimate goal is to achieve a greater contribution from pharmacists in patient-centered care, specifically in vaccination. To do so, allow me to recall some points discussed in previous conferences. First, we could separate those aspects from external, which you can see on your left, from those internal to them on your right. Advocacy, social background, and sustainability on your left are factors that depend on health systems and society. Therefore, they should be a priority for stakeholders who may have a political, economic, and social impact in health system. It should be noted that some of them can be seen as opportunities. For example, in my country, Costa Rica, the social background has played a fundamental role in the development of pharmaceutical services, despite the fact that sustainability has been one limitation. Traditionally, in Costa Rica, the pharmacist has been the health professional closest to the patient. She or he has offered advice on medicines for so long and is authorized for the administration of different vaccines with or without a prescription. As a result of this historical work, however, vaccination service is considered as one more activity of the pharmacy, as long as the user purchases the vaccine in the establishment. That is, there is no additional payment for the administration and counseling that we provide as health professionals. And here I want to stop one moment to say that even if we have this limitation, this is not a reason to stop doing it. We have to keep on moving and doing the advocacy necessary to recognize our job. Now, in relation to aspects on your right, infrastructure and equipment and knowledge, skills, and abilities, although I see them as internal aspects, they are closely related to external factors. They depend on them. And also they depend on academic capacity of the country. So I made a division, left and right. But if you want to see as a total, they are intrinsic related. What I would like to say is that with all of these and the example that I gave you, is that sometimes the way may not be perfect. The picture may not be perfect. And a program implementation must be based on each country reality. Ideally, we would like to have a free and wide way to do the things. However, this is not always the case, and we have to struggle for participation. For me, it is very important to say this at this moment because I know that we have people from different countries and they have different realities. And we have to know, and this is one of the objectives of this series, we have to know of others and know that we all face limitations and opportunities. On the next slide, I would like to ask a question. What do we need in order to achieve a program of vaccination services? I made a proposal on the document published by FIP, and also I made a research about the articles published on this area. And today I want to show you this reference. This recently published article by Crespo reviewed the strategies for innovation and implementation of a pharmaceutical service. They collected information of 123 studies and built the present framework you can see with three performance domains: economic, social, and environment. In each of them, the factors that affect them are shown. And as we can see, they are similar of those in the previous slide. For example, in the social performance, you can see aspects related with pharmacy staff, leader or champion, patient, community. With environment, you can see the system, the political environment, which is so important for us. And the economic performance, you can see the partnership and the financial environment. We should note that a program implementation is immersed in the middle of these domains and involves a cyclical process that includes the adaptation and evaluation of the program from a routinization process. This proposal, and that's why I bring it here, shows the comprehensive nature of pharmaceutical service. For these reasons, in the next slide, please, I want to show you the FIP Development Goals. I know that today's talk is focused on Goal 7, Advancing Integrated Services. But Analyzing the context and the situation in which the profession finds itself, I cannot fail to mention the connection between this goal with others also found in the document. It was really difficult to me to select the most related. Therefore, I chose the following: 1, academic capacity; 2, early career training strategy; 5, competency development; 6, leadership development; 8, working with others; 9, continuous professional development strategies; 11, impact and outcomes; 13, policy development; 15, people-centered care; 16, communicable diseases; 18, access to medicines, devices, and services; 19, patient safety; and 21, sustainability in pharmacy. What I see when I see this slide is that we see a continuous process, a connected process, and we cannot go forward if we don't take into account each one of the development goals, which are very clear about what is the profession and where we want to be in the following years. For more information about this, you can search them at the link below. And as I can see in the chat, the link was already sent to you. And on the last slide, the following slide, I would like to conclude with the following points. First, if we want to do a strategy to implement vaccination services, this must take into account the historical, legal, and social framework of community pharmacy in the country. We can do this analysis in order to find the opportunities we can use it to promote these services. Second, this process should be seen as a continuous, dynamic process, evolving based on experience. I know that for some countries, the administration of vaccines is still not a reality, but we can start with other functions and continue evolving on this in order to achieve our goal. And third, should be integrated into a strategic plan that includes health authorities, organizations, universities, laboratories, and last but not least, pharmacists. This is quite important because if we don't work together in an articulated way, it is going to be very tough for all of us. So we have to find a way to organize ourselves, to find the way we need to achieve the vaccination services. And as a last thought, I'm going to rescue an idea with which I concluded Series 1. When I concluded Series 1, I said to myself, and I said to other colleagues, one step at a time. We have to think and act one step at a time. And with this second series, I would like to add some small but significant words. One step at a time, based on reality, on our reality, and with clear expectations. What do we want and how are we going to do it? What do we have? Because if we do not have all the ideal scenario, we have something. We have our profession, and we have our work, and we have organizations, and we have our advocacy. So with this, I would like to conclude this presentation, and I would like to give this space to my other colleagues in order to provide the information from other countries. Thank you very much, Barbara.
Sophia, I thank you. Thank you so much. When we take the last point of your conclusion, we understand which path ahead countries without vaccinating pharmacists will have to walk. Thank you, Sophia. I propose that we discuss this context later and continue now with our second speaker, Pamela Logan. Marwan, the next slide, please. Pamela was qualified as pharmacist in 1986. She spent 16 years working in community pharmacy in a variety of management positions in the UK and Ireland. In 2001, Pamela went to Namibia with voluntary services overseas, where she worked for 2 years as a country coordinator on the pharmacist assistant course with the Ministry for Health. On her return in 2004, Pamela took up her current position as Director of Pharmacy Services for the Irish Pharmacy Union, the representative and professional body for community pharmacists in Ireland. Her role involves promoting the role of the pharmacist through influencing government strategy, developing and maintaining links with relevant stakeholders, patient groups and government agencies, and liaising with politicians on pharmacy issues and legislation. In her role with the Irish Pharmacy Union, Pamela provides services to pharmacists such as professional advice, assisting pharmacists in complying with pharmacy and medicine regulations and guidelines, delivering health promotions in community pharmacies in collaboration with patient groups, identifying opportunities for new innovative pharmacy services, and developing standard operating procedures and guidelines for pharmacists to deliver such services. Pamela, we are keen on listening to your experience. The floor is yours.
Thanks very much, Barbara, and lovely to see you all virtually. Greetings from Ireland, where it's a sunny lunchtime Tuesday afternoon. So I'm just going to give you a brief overview of flu vaccination in pharmacy in Ireland. My talk is mainly about flu vaccination, though we can do other vaccinations. So I'm going to, my overview of my presentation, next slide, is to talk a little bit about Ireland itself. Could you move the slide, please? And talk about the case that pharmacists can make for, all pharmacists can make for pharmacy involvement in vaccination. And I'll talk a little bit about how did we get flu vaccination into Irish pharmacies? How do we promote that flu vaccination? And then I'll give you some idea of the results we've had from the uptake and some feedback from the public as well. So the next slide. The next slide. Okay, I'll just keep going because the slides seem to be frozen there. I'm not really sure why. Ireland's a pretty small country. We've only got a population of just under 5 million, and we have about 1,850 community pharmacies. Most of our pharmacies are owned by pharmacists, which is unusual because we have no establishment or ownership criteria, so anybody can open up a pharmacy anywhere. We do have some of the large international chains like Lloyd's and Boots and Allcare. Each of those only has about 100 pharmacies. So as I said, the majority of Irish pharmacies are pharmacy owned, maybe with some small chains. The next slide will show that you do have to make a case or provide evidence for getting pharmacists involved in vaccination. FIP's got some great case studies from around the world, and excuse me, there's a lovely research study called Pacific Research Institute, which looks at the case from empowering pharmacists to increase adult flu vaccination rates. And what this study, which was mainly based in the US, showed was that allowing pharmacy vaccination improves overall vaccination uptake Slides I'll show you about Irish vaccination later will show that that is the case. It's also acknowledged that by pharmacies providing services such as vaccination, they're closer to people's homes. And that's particularly important in the current coronavirus pandemic. Currently in Ireland, we're on a lockdown where we're not allowed to go more than 5 kilometres from our home. You could go a little bit further for healthcare services, but patients want to be able to access whatever services they want as close to their homes as possible. Patients also tell us that they want to access vaccination where it's more convenient to them during their lunch break or in an evening or a weekend. And we know that most doctors' surgeries operate Monday to Friday, 9 to 5. So certainly a pharmacy is much more convenient. And it's also important that people in rural areas get an opportunity to access such healthcare services as well. So a lot of the towns and villages in Ireland, in rural Ireland, may not have a GP service. So it's important that pharmacists are able to deliver that vaccination service. Next slide. So ultimately, the case is that more trips to the pharmacy can mean fewer trips to the accident emergency. So just an example of how important this is, and it's not just a couple of pictures. Back in 2017, when we had a really bad flu vaccine or flu outbreak, the flu was quite serious that year, we had queues in our accident emergency in the January and February of 2018, where people couldn't even access beds in the hospital because there were too many people trying to get into the hospital. These were mainly flu cases or complications of flu, such as pneumonia. In that Q1 of 2018, our health service reported an overspend of 80 million euro. So it was costing them 80 million euro for that queue of people waiting on trolleys to get into a bed in accident emergency because they had flu or the complications of flu. And at that time, we in the IPU did a quick calculation of how much would it cost the government to give a free flu vaccination to everybody in the population. And we calculated it was about 60 million. So 60 million for flu vaccination, 80 million for the cost of the hospital treatment. So it's not rocket science to know the value of pharmacy getting involved in services such as flu vaccination. In the next slide, I'll just give an overview of how did flu vaccination actually happen in Ireland. So we're all aware of the WHO vaccination targets that say we're aiming for 75% of older people or people with chronic illness to get vaccinated. And back at the time before pharmacies started doing flu vaccination in Ireland, I think the Netherlands was the only European country to meet that 75% target. The UK was a little bit behind, but most of the rest of the European countries were nowhere close to that. Our pharmacy regulator in Ireland, the Pharmaceutical Society, produced a future strategy for pharmacy services in Ireland, and they included vaccination in that. So when you're trying to lobby government or persuade government to introduce a new service into your country for pharmacists, it's important that all parts of the sector are involved in that. So the pharmacy regulator, the professional bodies, the educational bodies, so we all got behind that. And then in 2009, we had the H1N1 swine flu pandemic. And goodness, at the time we thought that was bad, didn't we? And how wrong were we? So at that time, a national vaccination campaign was launched. And it was acknowledged that there weren't going to be enough GPs to vaccinate everybody against H1N1. So we went to the Department of Health and said, well, we'll help you, we'll do it, but you need to train the pharmacists first. So at that time, 1,400 pharmacists were trained to vaccinate everybody. But then we discovered that the H1N1 virus wasn't as virulent as it was first feared, and therefore they decided not to vaccinate everybody, just certain cohorts. So we weren't needed at that time in 2009, but at least the seed had been sown that this was something that pharmacists could do. In 2011, we got a new government, and our new Minister for Health produced legislation to allow pharmacists to supply and administer the flu vaccine without prescription. So what we needed this legislation for, there was nothing in our legislation that prohibited or stopped a pharmacist sticking a needle into somebody. What we needed the legislation for was to allow us to supply a flu vaccine, which is prescription only, without a prescription. So our legislation is written like an except when. So a flu vaccine is a prescription only medicine, except when supplied and administered by a pharmacist following a bunch of regulations and making certain records. And then in 2015, we expanded that to flu vaccination to cover pneumococcal and shingles as well. Now, pharmacists can also administer other injectables, but they would need prescriptions. So for things like vitamin B12 injections or injections for osteoporosis for every 6 months, etc. If the patient comes into the pharmacy with a prescription for those injectables, the pharmacist can administer them, but we do need the injection, or we do need the prescription. Next slide will show the kind of training that we needed to have to do vaccination in pharmacy. It probably doesn't differ from most of the other countries that do it. We had to make some changes this year because of COVID. So if you've never vaccinated before, typically up until this year, a pharmacist would have had a one-day training course face-to-face. And in that training course, we would have covered things like injection technique, the management of anaphylaxis, CPR, etc. But because of COVID this year, we put a lot of that online, but the CPR did have to be face-to-face. It's very hard to teach somebody cardiopulmonary resuscitation unless you're in a room with them with the dummies, etc. And then we have a number of other online training courses to cover things like the specific vaccines like pneumococcal or flu or shingles, and a few others about setting up services and stuff. It's also a requirement that all pharmacies have a set of policies and standard operating procedures. And as the representative body, the IPU would produce templates for pharmacies to help them introduce that. And then we do have refresher training for some of the courses every year, like flu vaccine, because that changes, and for others every 2 years. The next slide shows the regulatory requirements. So when the legislation first came out in 2011, pharmacists were only allowed to vaccinate in the pharmacy, but in October this year, that's been changed to allow us to offer the flu vaccination outside of the pharmacy. And this year, for the first time, we've been doing children as well, aged 2 to 12 years old, using a nasal spray. And then there's a bunch of records that we need to keep. We need obviously to get patient consent. We need to check the patient's allergy status. We need to monitor the patient afterwards for anaphylaxis. And we need to give online real-time notification to our health service as to who's been vaccinated, whether the state pays for them or not. And then if the patient wants, we can tell the patient's GP as well. In terms of remuneration, I'll just talk about it briefly here. Up until this year, about 40% of people in Ireland are entitled to free healthcare, which means they don't pay to go to see a doctor, they don't pay for their medicines. So up until this year, our health service would have given a free flu vaccine to everybody that was in an at-risk group. But if you were entitled to free healthcare, the state paid for your vaccination. But if you weren't entitled to free healthcare, the patient had to pay for the vaccination administration themselves. This year, because the state wanted as many people as possible to be vaccinated against flu, the state pays for all at-risk people's vaccine and administration. So they pay that directly to the pharmacy, and that's allowed us to get a much bigger cohort. The next slide just gives a little bit more detail about what we can do outside pharmacies. So the Irish Pharmacy Union had been advocating for years that we pharmacists should be allowed to vaccinate outside pharmacy, because a lot of our patients were vulnerable. They were in nursing homes, they were at home, they couldn't always get to the pharmacy, even though the pharmacies are conveniently located. So this legislation allows us to basically go wherever we want. So pharmacists are reporting that they're going to patients' homes, especially those patients that may be cocooning because of COVID. Some people are driving up to outside the pharmacy, but they don't want to come in because they're afraid of COVID, so they can be vaccinated through the car window. Some pharmacists are hiring rooms in sports centres or church halls so that they can do a number of people in those places. Because we're doing children, some pharmacists are going into schools and crashes and doing all of the children there who are eligible between 2 and 12, obviously with the parental consent. But pharmacists are also going to offices and factories such as chicken factories, because people who come into contact with fowl are considered an at-risk group here. So that's been very helpful for us to have vaccination outside pharmacy. The next two slides, you can flick them quickly, show how we advocate. So both our health service and the Irish Pharmacy Union would do a series of social media streams or radio ads to encourage people to get vaccinated against flu. This year we didn't do any, or we actually pulled it and we stopped it because such was the huge demand for flu vaccination in pharmacies that we didn't want to advertise it at all. We started vaccinating against flu in at the beginning of October, and we've almost exhausted all of our vaccine. So there's very little vaccine left. We haven't got all of our at-risk people vaccinated, but we've probably got the majority of them. We've probably done about 25% increase on flu vaccination compared to last year. Next slide, next slide. Next one. The one with the flu vaccination statistics. So I said at the beginning, could you move the slide please, Marvin? I said at the beginning that when pharmacies start doing flu vaccination, everybody benefits. The patients benefits, the state benefits, and all healthcare providers do. So I'm sure those of you that do flu vaccination got a great backlash from their doctors when you started doing flu vaccination. People who are trying to do pharmacy vaccination now are getting backlashes from the doctors going, you'll just take our patients. What's the point? You're just taking patients and moving them from one place to the other. Well, the figures that we've gathered since 2011 show that since pharmacy started vaccinating, our national flu vaccination has gone up by 60%. And GP flu vaccination has gone up by 27%. So that just shows that when pharmacists vaccinate, the awareness is raised so much that all providers of vaccination see an increase. Up until last year, GPs, I don't have the figures obviously for this year, but up until last year, GPs were accounting for 70%, 72% of all flu vaccinations, and pharmacists were accounting for 16%. So we'd hope to see that increase. And then I'll just flick you quickly through the last couple of slides. The next slide, back in 2016, our pharmacy regulator did some patient surveys to see what patients thought of pharmacy vaccination. So at that time, we discovered that 1 in 6 patients who were getting a flu vaccination were getting it for a flu vaccination for the first time. 32% of people in pharmacies at that time were getting a pharmacy flu vaccination for the first time, and 68% had been returning to the pharmacy for a second flu vaccination. The next slide was asking patients, why do you go to the pharmacy? And you can see that convenience is the main reason why they go, but they also appreciate the reduced waiting times. And the final slide shows that the satisfaction rates with people on pharmacy flu vaccination are very high. 95% about the information, 93% about the service, 99% said they'd return. So we're very happy with those. The concluding slide just shows, just as a summary of what I've been saying in terms of if pharmacists do vaccination, everybody benefits. The patients can get a vaccination somewhere near where they live, vaccination rates increase, and especially at this time of coronavirus, when we're looking at COVID-19 vaccination, we need to increase the amount of places that people can get their vaccination. And the last slide is just showing exactly like Sophia said, that flu vaccination covers almost all of the FIP development goals. Thank you.
Pamela, thank you so much for sharing with us your story and all the detailed insights. For me, your presentation was very inspirational, and for our audience too. The first questions came in, and I propose that we discuss them later. I'd like to move on to our third speaker, Scarlett Pong. Since beginning of 2018, Scarlett is president of the Pharmaceutical Society of Hong Kong. She was chairwoman of the steering committee of the Alliance for Healthy Cities in the Western Pacific region and part-time member in the Central Policy Unit. She was also board member of the Hospital Authority and in charge with WHO's Age-Friendly Cities and Healthy Cities. Please welcome Scarlett. Scarlett, the floor is yours.
Thank you, Barbara. And thank you so much for the kind invitation of FIP. And it's my honor to actually share my views or my status in Hong Kong with other speakers like Sophia and Pamela. First of all, next slide. So I will keep on talking first. Hello? 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 Hello. Okay. I would like to talk about the existing situations in Hong Kong. We have about 7 million people in Hong Kong, and our situation is that we don't have no separation of prescribing and dispensing of drugs. So that's why when you look at the community pharmacy, there are limitations for the role in the community. And for vaccinations, after the FIP conference in the past years, we are developing that in Hong Kong. And we have obtained verbal support from the top management of the cities, like the Secretary for Food and Health, and also the Dean of the Faculty of Medicine, and also University of Hong Kong. However, the implementation faced difficulties. Why? Because all our vaccines are prescription items. So therefore, we need to work with doctors and not independently. As you know, there are different views of other stakeholders like the doctors and also nurses that might not or would not like us to enter into the vaccination services as well. Next slide. So vaccination, I think we have to go back to the previous slide. Can we go back to the previous slide? For the training, PSHK actually provides practical training with the support of other healthcare professionals like doctors and nurses. And we train the pharmacists, performed vaccination, mainly seasonal influenza, under the government vaccination subsidized scheme. So that's why under that scheme, we have a lot of requirement from the government. With the high-risk group, we will have subsidies, and each subsidies is around $100 Hong Kong, for our vaccinations. We plan to have certificate program, training program for our pharmacists in the future, and we are planning to do that. So we have different topics that we will include, including vaccine developments, preventable disease, patient care, and operation and risk management. Operation is quite important in Hong Kong because we are not as large a space in the pharmacy. So that's why some of the pharmacy in Hong Kong might not be able to have a bigger space with the privacy for the patients. So that's why we have to look at the design and work with Department of Health on this. So of course we have practical training as well, and also CPR. We have fundings from the government for our pharmacy professional development, so that we will have coverage on that, so that our pharmacists can join our program. So next slide. Next slide, please. So when we look at it, look at the social determinant of health under COVID-19, we find that, there are quite a lot of patients are reluctant to go to the hospitals and clinic, and the quarantine affect the drug supply. So that's why we try to be active in the society. As you all know that, we don't have a lot of road in the community. So that's why we actively participate in different programs that the public needs. One of them we are doing, currently is doing too, is the special scheme to deliver prescription medication to Hong Kong residents who are currently located in mainland China with urgent needs for medication. We can build trust and also support from the public. And so we cooperate with other parties to design the logistic so that we carry out drug reconciliations and counseling for the patients, and also deliver the urgent medication by courier. We now, from February till now, we serve over 30,000 cases in Hong Kong by pharmacists. And for the second one is the COVID-19 Universal Community Testing Program to find the asymptomatic patients for COVID. PSHK actually initiate to support the government on that program and mobilize pharmacists to work with the other healthcare professional for the swab services. For the 2 weeks that we participate, we did about 1.8 million specimen in 2 weeks. So this has been enhanced our collaboration with other professionals and also to be part of the team, so that in the future, we would like to discuss with the government when they have the vaccine in 2021, we would like to have the vaccine done by the pharmacists as well. Next, please. So next slide. So when we look at the goals and also actions, we have 4 goals and also actions. First one, we would like to actually authorize pharmacists to do COVID-19 and also flu vaccines independently. This is our goal, and this is quite important, and we will continue to lobby the governments on that. The second one is improve our training program with the certificate and also the program that we mentioned before with the details. The third one is we would like to continue to gain public trust for our professions and also increase our recognition with other healthcare professions as well, because I think we need to be more active to work with other professions so that we can be well recognized and also can be partners. And this is quite important is because starting from 2017 onwards, our chief executive in Hong Kong is launching a district health centers in 18 districts. So pharmacists will be involved in serving or giving primary healthcare services with other team, and the doctor will not be in the center. There will be a network doctor that help us to screen the hypertension and also diabetics mellitus cases like this, but we can actually serve the patient directly in our center. Fourth, we invite FIP management to send support letter to our Chief Executive and Secretary for Food and Health Bureau to share international experience on vaccination by pharmacists. And I think it's quite important that we have international support, and also, as what Sophia mentioned earlier, one step at a time based on reality. We know that we have to work with the policy and also the classification of vaccines, but we are quite confident that with the support of our members and also in the national arena with the pharmacists internationally, we will achieve step by step. Thank you so much.
Thank you, Scarlett. Thanks a million for your talk. And if you agree, a lot of questions came in, and dear colleagues, please, you could help perhaps a little bit. Let's get started with our questions. There is one question that came in, and it's for Pamela. Pamela, the question from Jasmine is whether the Irish Pharmacy Union is part of any vaccine alliance.
I'm not quite clear what she means by that question, but there are 2 alliances within Ireland that we're part of. So one was about HPV. So because of all the anti-vaccination myths that started out a while back, our HPV vaccination rate dropped from 85% down to below 50%. So all of the stakeholders, the department, the health service, lots of patient organizations did a lot of work over a year to try and dispel those myths about HPV vaccination, and that HPV Vaccine Alliance increased HPV vaccine uptake again back to about 80, in the high 80s. And then last year, our Department of Health formed just a general vaccine alliance, which again was all of the stakeholders trying to promote vaccination. We haven't probably done too much this year because I think COVID-19 kind of overtook events.
Thank you. And there is another one from Felicia. It's also for Pamela. Felicia asked which research approach you use to understand the satisfaction of the public.
So back in 2016, our pharmacy regulator had indicated that they'd like to do some patient study on flu vaccination. So as the patients were in the pharmacies getting vaccinated, the pharmacist said to them, would you be interested in taking part in some research? And if they were, they give the pharmacist their phone number, and those phone numbers were shared with the pharmacy regulator, and they got a researcher to phone those cohorts of those patients. So it was, you know, that there's a really good report written on it on the Pharmaceutical Society's website. But it meant that we got the feedback from quite a lot of patients.
Okay, thank you. Marlin from Belgium is explaining that they do a lot of training and training that takes place right now. They want to be prepared for the injections for the vaccine to treat COVID-19 or to prevent, and there is no legislation. So I think this is a question to all speakers. Do you have any recommendations for Marlin?
Maybe I could come in there. If you think back to my presentation, the reason that there was an interest within our Department of Health for pharmacists to get involved in vaccination was because of the H1N1 swine flu pandemic back in 2009. So at that stage, we were saying, you can't vaccinate the whole population. You don't have the resources. You're not going to be able to do it. And they agreed that they didn't. Now, we weren't needed at the time because it wasn't been that bad, but it's exactly the same scenario here. And we do need to do the whole population. For those in Europe, and this obviously applied to Belgium, the European Centre for Disease Control produced a technical report there just last week on 26th of October 2020, looking at the key aspects regarding the introduction and prioritization of COVID-19 vaccination in the EU. And it requires all stakeholders to get together to work on this together, because we're not going to be able to do it in silos.
I totally agree. Okay, thank you. And there is another question that came in from an anonymous colleague. He likes to understand whether there is any approach, and he is asking whether we shouldn't include in our campaign the other injectables.
I would like to answer this question.
Yeah, thank you.
Okay.
Yeah,
I know that the question is absolutely true. Why only vaccines? We can do it a lot if we have the training, if we have the recertification, if we have the advocacy. But here we are focused on vaccination, and I think the strategic plan has to focus on this because vaccines are very important for society. I think that with COVID-19, people already know the importance of preventable diseases. And if we take this social moment and see the particularity of vaccines, we can do a strategic plan which can be different from other medicines, such as injectable contraceptives. I don't know. I see it. I don't know if you hear me. Okay?
Yeah.
Can you hear me?
Yeah.
Okay. I see it that there are different plans. I can see it like that. Can we do all of that? Yes, we can, but one step at a time and with a clear objective.
Yes, we remember your call to do one step after the other. Yeah.
Yeah.
Yeah. Thank you, Sophia. Let's check whether there are other questions. Yeah, they are on the recertification and whether recertification is included in the training programs. And of course, there's also, it comes together with the need to update the training programs on a regular basis. Do you like to comment on that?
Okay. Actually, I was reading several questions related to academic capacity, and I think that are very close, each one of them.
Yeah, yeah, I agree.
Yeah. It is not possible to do a program of vaccination services if there is no contribution from academy and organizations. So if you ask me for the particular case of Costa Rica, we actually have courses and training, but they are not mandatory for now. We have to move on to this mandatory recertification, but we still have not that figure. So in addition, I want to say that universities have to keep in mind that the formation of professionals should include vaccination service, not only the service like that. They should include information and related to preventable diseases, vaccines, regulations, importance of vaccinations, anti-vaccines groups, and all that. We have to do we have to see it as a comprehensive nature of the vaccination for the society.
Thank you. Thank you. May I ask a question for all the speakers? And we'll have a round. We start by Sophia, then we go to the other speakers. So knowing that healthcare systems differ from one country to the other, do you have any additional ideas how to overcome the resistance from the governments and from other healthcare professionals? So we see that, we know it, that we have sometimes resistance from other healthcare professionals and even sometimes from governments. So may you give us some tips or some ways in order how to address them, how to deal with those resistance?
I don't know. May I speak?
Oh,
Yes.
Yes, yes, please.
maybe I can.
Or the three of you. We would love
sure.
to hear the three of you. Yeah.
Sure. I just want to share that, I know that there might be resistance from the government and also resistance from the other healthcare professional. So that's why I think we have to be more proactive, like to be fast enough and also targeted and consistent. Like, for example, as I mentioned earlier, the COVID-19 swab test, because of the situation in Hong Kong of the third wave, they find that, they need a healthcare professional to do the swab. So that's why we initiate and just go directly with the government and say that, we will mobilize pharmacists to support them, and I think with that working relationship, we hope that this will open the opportunity for us as part of the healthcare team. So this vaccine hopefully can be different from the other, like a prescription item, so that pharmacists can work on it next year. Because if you want to cover it in a very short period of time, just like the COVID swab, like 1.8 billion in 2 weeks is not easy. Even you take your GP, nurses, it's really difficult to achieve that amount of, vaccination services. So that's why I think we have to be proactive and see whether we can get opportunities for our profession like this.
Thank you. Thank you.
Mike Min?
Sophia or Pamela? Yeah, please.
Yeah, I'm often asked this question when I present about pharmacists vaccinating, and people are probably, maybe it's been from Northern Ireland and been very abrupt. I don't ask doctors their opinion on what pharmacists do, because doctors don't ask me their opinion, on what they do. So we've got to think about why are we doing this? We're doing it for patients. So if the patients want vaccination in their pharmacy, if they want the pharmacist to vaccinate, if they want it to be closer to home, if they want it to be more convenient, and pharmacists can do it, then why would I go and ask the doctors what they think of it? Now, I know there's obviously, egos to overcome in some places, but we've got to just focus on what's best for the patient. With COVID-19 vaccine coming, and it will come next year, and we're going to have to do the whole population probably twice, probably repeatedly, because we're not sure what of the immunity. No country in this world has the resource to do that without using lots of extra people than they previously did. This is not flu, which does about 30% of the country if you're a really good country. This is not childhood vaccination, which does a percentage of the population because they're children. This is the whole population being vaccinated twice, being vaccinated repeatedly over the next 2 years. No government has got that resource unless they start involving pharmacists.
Yeah.
Can I add one more point on my presentation just now? I think I'm not talking about we have to get acceptance or from the doctor. I just say that, we need to work with other healthcare professionals. So that's why we will actually try to lobby the government to have vaccines, not as a prescription item, or the pharmacist can work on it independently. Okay, but I think, it's good that we worked, I agree with that, work for the people, of Hong Kong or with other countries. So we work for our best to do that. But I think with a very good working relationship with the team, like just what we are talking about, District Health Center, which will be open in 18 districts, serving 7 million people in Hong Kong. We will not have doctors in the center. They are only network doctors. Okay, so there are only pharmacists, nurses, PT, OT in the center that are serving, public in the primary healthcare sector. So that's why I think we can work closely with them so that we can serve them better and understand their need even better like this.
I absolutely agree.
Sophia, yeah, thank you.
Yes, I absolutely agree with Pamela and Scarlett. And I don't know, I think they were very clear. And I just want to say that we have worked for the people always. And at this moment, with COVID-19, we have to do it a lot more. And this is the moment to start doing this and working on this.
Yeah. I totally agree. I think this is my perspective, but I totally agree that COVID-19 is our accelerator. Yeah. There was another question in the chat box from Kupinat. He asked for research methodology and research message to advocate the vaccination through pharmacists. Do you have any approaches, any ideas? Which kind of research we should use to advocate vaccination through pharmacists?
maybe the example of the example in Ireland is one of things that can be maybe taken, and other countries that have vaccination. What do you think about that, our speakers?
Yeah, I mean, FIP has
So
produced a number of
maybe
different.
taking success stories.
Yeah, FIP has produced a number of really good documents that contain case studies of countries that do vaccination. But it is that kind of statistic that looks at how have the vaccination rates increased since pharmacists were involved, and showed that it didn't affect GPs at all. Also look at how hospital admissions have been reduced. We can also look at our Australian colleagues who've been through flu and COVID at the same time at the beginning of this year, and they showed a significant, probably the lowest number of flu cases ever, because they had a massive increase in the amount of pharmacy flu vaccination.
Yeah. When it comes to collaborative work, Scarlett spoke about networking. What are your thoughts to run a research showing that the workload will decrease so that we can manage to vaccinate patients, and to show this through a research?
I think, in Hong Kong, I think when we compare to other countries, it might not be that advanced. But I think, for vaccination that we did so far, we find that we can be in school, we can be in different residential areas, that they find it, like not just in pharmacy, because I said pharmacy, sometimes they are having limited space in Hong Kong. So that's why we are outreach to other places like school, and also we are in residential estates, and in the future we will have district health center that are actually serving the community at large. So that's why I think when we look at the acceptance, it will be a team of professionals together, helping them to do that. Because right now, the government actually have a guidelines that the nurses as a coordinator that can allocate clients, to pharmacists for drug reconciliations and consultations and all that. But, my aim or my goal is, we should actually expand the role of pharmacists in the center, because we should actually do vaccination as well, which the government would like to do. So that's why we would like to propose to government that, nurses, pharmacists should be able to do that in the center. So if they can expand the role in the center, and I'm quite sure that the recognition by the public will be increased, and we should be able to do much better research at that time.
Yeah, thank you. Colleagues Marwan and Farah, are there any more questions?
Maybe just an idea about remuneration in different countries. So we have the example from Costa Rica that they are not remunerated, but other countries it is remunerated. So what is the best approach to ask for the remuneration of the service? Any comments about that, our speakers? So, or maybe in Costa Rica, are you thinking about asking for remuneration for this service?
Well, that is a very difficult question at this moment. We are working on it. We are doing the advocacy, but as I said in the presentation, we had been doing this work traditionally, and in order to think in a reimbursement about the administration of the vaccine, we have been thinking about the service of injectable drugs. but we still don't have a national regulation for that. That is one of the limitations, as I said. What could be the approach to let the people know that the service that we provide is a professional service. It's a professional service for them. And we should be working for that. But no, I still do not have a question. If you want, we can talk in a year maybe, and I'll give you an answer.
Hopefully, yeah, hopefully. If we may know how it started, the remuneration in Ireland and in Hong Kong, maybe. So if you can have an idea about that.
You mean reimbursement?
Yeah.
Yeah, in Hong Kong, we have reimbursement for vaccinations for the high-risk group. And so they subsidize about $220, and vaccines is around 100 something. So that's why each individual vaccination services, we have around $100 Hong Kong. So this is actually set by the government, no matter what profession you are. But one thing is, our aim is, how can we make the vaccines accessible to pharmacists so that it's not a prescription item, and then we can actually do it independently. So that's our aim. Money is not a concern in Hong Kong because they have already got a subsidized scheme.
Mhm.
And in Ireland, community pharmacists get paid by our health service to vaccinate this year everybody in an at-risk group, regardless of whether they're entitled to free healthcare or not. So we get €25 for an injectable vaccination, and we get €35 for a child nasal flu vaccination. This is the same that GPs get paid.
Thank you.
Okay.
So what we know is the services are different and the legislation are different from country to the other. Our aim is to have vaccination in pharmacies for the best of our patients. And this is what we always want and what we always work for. Barbel, any other questions?
I have a last one, perhaps. From my side, no? The last one. Should I go ahead with that?
Yeah, please.
Yeah,
sure.
Okay. As our pandemic accelerated the transformation, are there any specific actions you recommend? Any specific actions you recommend now?
On vaccination or other related services or pharmacists that can do.
On vaccination.
Can we work on something like not just vaccination?
No, on vaccination, to be prepared.
Oh, on vaccination.
Yeah.
Okay. So that's one of the points that I already mentioned then. So it will be in the district health center that we can actually have pharmacists that do vaccination in 18 districts.
Yeah. The others, Sophia, Pamela.
Abel, would you please repeat me the question?
Yeah. We experienced an acceleration of transformation through the pandemic. And is there any specific action you recommend?
Okay, in this context, right now, with COVID-19 related to vaccination.
Yeah.
Okay, I think this is the moment to do the things, to start doing things. I know that there are many countries that have been working on these initiatives, but what Scarlett said about the need of pharmacists as health professionals for immunization for COVID when we will have the vaccine, or the flu or other vaccines, is going to be more and more visible to governments. So we have to take advantage of that and make the advocacy necessary to change the regulations and allow the pharmacists to administer vaccines.
Okay, yeah, thank you.
Possibly one thing that FIP could do is, so we've talked about that there's a lot of evidence out there. There's a lot of really good reports that FIP has done. There's a lot of good case studies from different countries, but people need something now. They need something to send to their Department of Health in the next week or two, because this needs to be done and sorted before Christmas. So maybe the FIP could write a template letter from FIP to the Ministry of Health and so that pharmacy organizations can download it, personalize it for their country and send it to their Minister for Health. And in that, probably no more than a 2-page letter would make the case why pharmacists should be involved in vaccination to help the country deliver COVID-19 vaccination.
That's a very good idea.
Yes, absolutely.
Yeah.
Sure. Yeah.
Thank
Yeah.
you, Pamela.
It will be one of our outcomes for the series finale, for the last episode of this series too. Thank you for all the ideas. Allow me to introduce our next episode, which is episode 3, and join us on November 5th at 14 CST. In this episode, removing policy barriers to pharmacist vaccination. It's also an interview format that focuses on the FIP Development Goals policy development from the perspective of vaccination by a pharmacist. We discuss development, identify barriers, and engagement people all settings where we have pharmacists. Register online at the transformingvaccination.fip.org, and we would like to really thank each of our speakers, and the recording will be available at www.transformingvaccination.fip.org. Barbara, thank you for being here, and I will keep the final remarks for this episode to you.
Yeah, thank you. The next slide, please, Marwan. There's another one. Yeah, please give us your feedback to webinars@fip.org so that we may continue to improve. And thank you very much. And we are really looking forward to connecting soon. And the last question to you, what do you think? Should we take advantage of the accelerated transformation of the pandemic and engage now and contribute now to the expansion of pharmacists' role in vaccination? Thank you and goodbye.